Still on COVID-19 in Nigeria, President of the Nigerian Medical Association, Francis Faduyile, says it will be pretty difficult for Nigeria's health systems to cope in the event of a large number of COVID-19 infections. He further notes that low health budgets over the years has made Nigeria's health systems weak. CNBC Africa's Christy caught up with him to assess the preparedness of Nigeria's health systems against the COVID-19 outbreak.
Before we had COVID-19 infection, we have always been complaining that Nigeria has weak health system. And this weak system is about the poor or the perennial low budget of fund to the health system. I can tell you many of our states' health institutions cannot contain, even treat. Many of them do not have adequate isolation ward, even federal government institutions. If you go to federal government, how many of them have the required number of PPEs that we needed for people who want to treat them? How many other things, equipment do you have in place? I heard the Minister of Health at the time saying that they will have to move one respirator from one area to the other. When you start using a respirator for a COVID-19 infected patient, you cannot take it there. And if you have a large number, you have not had a large number, we have very few numbers, you know that the effect is catastrophic. And the treatment of COVID-19 as it is today is to be able to stabilize, is to be able to maintain such person so that after a while the viral infection will wear off and the patient will come back normal. It's not as if we have found any treatment as it is. But we are hoping, because of the good response that we are having from some other drug tests, that once the treatment comes out, it will be easy. But as it is, I can tell you categorically, it will be pretty difficult for Nigeria to be able to take care if we have a pandemic or an epidemic or a large number of people infected in this country.
We have reports of some doctors across 14 hospitals in Abuja on strike at this time. How true is that?
Well, I think that the Nigerian Medical Association has come out and we have asked them to resume back to work, and I'm positive that they have come back for the benefit of Nigeria. And it must be important, it is important for me to state why they were on strike, those group of people. Some of them have not been paid for 7 months, even when they are doing their job. Some of them have been paid a fraction of their salary, a fraction to as low as 10% of their salary for over 3 months. These are not fault of theirs, and you cannot continue to grind or to ask them to be prepared and to come to work when they are not receive their salary and they are not sure. In fact, they don't have what they need to be able to take care of them, of their household. So it is a difficult period. But we have told them, let us work together, contain this, and let us see how we can face the government. We are interfacing with the government and we are hoping that we'll be able to get that resolved.
So you've raised some critical issues here now. Some of them include how poverty could be a drawback for isolation, for self-isolation and maybe social distancing as one of the measures already prescribed across the world by the World Health Organization. And you've also highlighted Nigeria's weak health infrastructure currently, even ahead of the COVID-19 outbreak. Now, as the NMA, what are the steps that you would recommend for Nigeria to take going forward? The numbers are rising, whether or not we like it. That's the reality.
Well, if you have been following how the COVID-19 infection has occurred in different countries, you will see that the number we have a steep rise. It's a geometrical progression. But I'm hoping that with the way in which we are containing it, we have started early, stop gathering, stop areas that we have to interact and get things, ensuring that we have social distance, ensuring that we do this. We may be able to contain it early enough. Okay, that is one good thing. I was very happy when I heard that the federal government's asking all the higher institutions to close down, asking all the primary school and unity school and secondary school to close down. Those are good areas in which we can actually stop the spread of that disease. But importantly, what we need to do is for us to be able to have a strong health system. For example, now, if we have cases, I'm very sure we do not have enough isolation wards for them to be treated. Okay? Even if we have enough isolation wards, many of our hospitals do not have the necessary PPE. That's personal protective equipment for the health personnel to treat them. Many of our hospitals do not have the necessary clear running water that you can use to wash your hands. These are conditions necessary to be in place for you to be able to guide against COVID-19 transmission within this country. So we are in a very precarious situation. And one thing that the Nigerian Medical Association must do, which we are advocating for, is that we don't want any of our members to die due to negligence of the government in providing the necessary equipment for them in treating patients. If you have seen the world over, many health personnel have died while trying to take care of the patient. These are some of the hazards that we face, but we must reduce it in such a way that we do not have unnecessary deaths among us.
As we speak now, are there clear-cut conversations or decisive conversations among the hierarchy of the Medical Association and maybe the government officials to talk about how to train health officials who will definitely be the first responders in case of an outbreak?
Well, there are some, but it is likely not in such a way that you have a planned plan. It's just every state just do one or two things, and it's not the one that we expected. We expected the government to be able to call the Nigerian Medical Association, the nurses, who are the first set of responders in this treatment, for us to come and tell them we have our members all over this country. They need to hear from those of us who are at those levels. But they are doing it as if they know all. But we'll continue to partner and get ready to do the needful, because this is for Nigerians.